Hi everybody, my name is Marissa Van Name and I will be doing the part A of the autism spectrum disorder along with Alana Scott, which will be doing part B. My part of the presentation, we're going to be speaking about what is autism spectrum disorders and what they are, what are the diagnostic criteria, and what are the severity levels of the autism spectrum disorders, as well as what are the causes. Autism spectrum disorders, also known as ASD, can also be referred to or known as pervasive developmental disorder, Rett syndrome, childhood disintegrative disorder, Asperger's syndrome, or autism. The term pervasive developmental disorder is a term used to refer to a group of conditions that involve delays in the developmental of many basic skills, such as the ability to socialize with others or communicate or use imagination. ASD affects 1 out of every 68 children in the United States. Studies have shown that the disorder occurs more in boys than in girls. Autism spectrum disorder affects 3 different areas of a child's life, which is their communication skills, their social interactions, and their behaviors. According to the DSM-5, the diagnostic criteria for autism spectrum disorder gives you a number of different reasons, but they basically, for the social emotion part of it, they have an abnormal social approach, and they have a failure of normal back and forth conversation, reduced sharing of interests, also their emotions or their failure to actually interact socially. Their nonverbal communication behaviors is basically their verbal and nonverbal communication, their abnormalities in eye contact and body language, and their non-understanding of gestures. A lack of facial expressions is also another part of the diagnostic criteria. Maintaining and understanding relationships and difficulties adjusting behaviors and transitioning is another part of the diagnostic criteria. And then the absence interest of peers is another huge part of it as well. So during the diagnostic criteria, there's little repetitive motor movements, as well as different routines, which is a part of the transitioning. They have a different hard time understanding from going to the food shopping or going to the store. They have tantrums, they have meltdowns. They just can't understand, they can't adjust to different times of the day. They're highly restricted interest and intensity of focusing on certain things as well. And then they're either hyper or hypoactivity to sensory input, and that's part of like the sensory disorder, which is another part of autism. So symptoms must be present in the early developmental period. The symptoms can cause clinically significant impairment in social, emotional, or occupational. A lot of children that are diagnosed with autism do receive therapies such as OT therapy, speech therapy, and play therapy. And these therapies are put in place for children to, they push them to the limits. For example, my daughter is autistic, and even though they know that she's going to have a tantrum or meltdown, they want her to try to understand that sharing is important. Going from inside to outside, there shouldn't be a fight or a struggle or a meltdown in this. It should just easily, we have to prepare them. There's time schedules, there's picture schedules that we use in order for them to understand and get them ready for what's going to be happening next. So the severity levels of autism, there are 3 different levels. Level 1 is just requiring support. Level 2 is requiring substantial support. And level 3 is requiring very substantial support. And these levels are used even for these children to even get services. So when children turn 3 years old, they are in different states, it's called different things. I know in North Carolina, it's called EC preschool. And EC preschool is a preschool that children with developmental delays do get. And it's based on the severity of the developmental delay. So if your child's at a level 1, they might get maybe 1 or 2 hours a week of this preschool, which their early interventions would stop because early interventions go from birth to 2 years old, and those early interventions would be the OT therapy, the play therapy, and the speech therapy. So for level 3, that's requiring very substantial support. It's basically when there's severe issues with the verbal and nonverbal social communication skills, very limited social interactions, and very minimal response to social interactions. Extreme difficulty coping with change, also repetitive behaviors, and great distress or difficulty changing focus or action. For level 2, which is requiring substantial support, is limited initiation of social interactions. So they aren't completely against social interactions. They are very limited to who they're going to have social interactions with. Reduced or abnormal responses to social overtures from others. Difficulty coping with change. Repetitive behaviors. Casually observing others without interfering with them. And then distress or difficulty changing focus again. Level 1's requiring support. So without the supports in place, the social communication cause impairments. So difficulty initiating social interactions and giving clear examples of responses to social interactions to others. And then they might have a decreased interest in social interactions with their peers, and then difficulty switching between activities. Problems of organization and planning as well. My daughter's at a level 1, and even though a level 1 seems to be easy, it's not very easy at all. Level 1, even though she needs the support that she gets. She does get early intervention, she does get speech, she gets play, she gets OT. It's several times a week, and it's very time consuming. And it's not only that they're required to do these therapies during those distinguished times, it's a continuation on my part to keep up with these therapies that were being taught. When she doesn't receive the therapy, when we went on vacation for a week in the summer, I seen a regression, and that was the worst feeling as a parent, to see your child progressing this whole time receiving the therapies, and then the 1 week that she didn't, completely regressed. So it's a continuation on your part, being as a parent or a guardian of a child with developmental delays such as autism or ASD, to keep up with all the therapies that they receive, and understand and study what's going on in their mind. Because as a parent, you blame yourself at first, but once you realize that they have a different output in life and the way that they look at things, it's very interesting. So the causes of autism spectrum disorder, nobody really has a cause for it. They have some ideas. Some say it's neurological, some say it's genetic, some say it can be environmental, the air pollution. I have looked at everything, and every cause that you can possibly come up with. There's always a cause and an effect to everything, I think, in life, and I just think that it happens. And I do think that it could have been in the environment, it could be the genetics, it could be any of these, but scientists haven't pinpointed the exact cause of ASD. So the video that I picked on autism spectrum disorder goes just a little bit more in detail of the signs and how you diagnose autism spectrum disorder. As a parent, I was very much against getting my daughter evaluated for autism. My mother's a nurse, so that is why I decided to go ahead with the diagnostic part of it. Just because I just thought that she was always hard. And what I always recommend now, after studying and after being having her diagnosed, is that if you do think anything's wrong, just go and get it checked out. The slightest thing, it can't help all it can't hurt, it can only help you. I'm very grateful and happy that I got my daughter diagnosed at such a young age. She's only 2, so I mean, and I've seen so much of an improvement. It's beyond belief, and I'm so grateful for that. I thought this little um, acronym for autism was really cute. Always unique, totally interesting, sometimes mysterious, and I definitely feel that that is my daughter. Well, I hope you all enjoyed my recording, and Alana Scott will be talking about the article next. And thank you very much. I will see you all soon. Bye.